this isn't about cures, I'm assuming. Like when you have psoriasis, there isn't a way just to say, right, I'm going to do a few things and then it's kind of going to be eliminated. I'm assuming the functional approach is actually how do you get your body in a place where you're going to keep the symptoms in remission? Is that fair to say?
Yeah, I always think it's about controlling it and controlling it to the point of clear skin, which I've seen myself and many clients have seen. But I personally always feel like it's there in the background, but it can be controlled. So, yeah, with most autoimmunity, it's the same case. It's about controlling it.
So when somebody comes to you originally and they're kind of suffering with psoriasis, talk me through what that sort of journey can look like. Let's take somebody that all they've done so far is they've maybe been to their GP, they've had some steroid creams, maybe they've kind of had some light therapy, and they start thinking about a slightly different way. Can you talk me through a little bit about what that sort of functional approach to psoriasis looks like?
So the way that I work, I'm a naturopathic nutritional therapist. So it's a holistic method of looking at the body as a whole. So I would go through in a consultation with somebody, just going through the whole timeline back to when they were born, looking particularly at the gut because there's this big gut psoriasis link, but also looking at things like hormones. Women in particular can get psoriasis flares either just before a period or during ovulation. Also, pregnancy can sometimes flare the skin, sometimes clear the skin. It's never the same for everyone. So we delve a bit more into hormones, nervous system. There's a really big stress factor there as well, and getting all those pieces of the puzzle together. So exercise, sleeping, making sure someone's sleeping well, hydrating, stress, and of course getting the right kind of nutrients in. So the nutrients to support the skin, but also just making sure there's not too many inflammatory foods going in there as well.
And so when you kind of start with somebody, is there a way that, do you start with some kind of testing? Can you get more data? Like, how does that work? And again, let's take somebody back from they've been in their GP. There isn't a traditional psoriasis test that you can kind of do. So talk to me a little bit about that.
So I'd always generally ask the GP to do some blood tests. And the ones that the GP would generally do is things like vitamin D. So there's a link with vitamin D and psoriasis. B9 and B12 to check for something called methylation in the body, which is quite important, which is linked to all of the cells and is the backbone really behind all of the functional pathways in the body.
So methylation, what you're saying there is actually your ability to actually absorb certain, is that right?
Well, methylation is I always think of it as the language that our cells use to speak to each other. So it's behind all of the chemical pathways. So it makes DNA in the body. So it's literally making skin cells. It's behind liver detoxification, energy production, Krebs cycle. It produces all of our neurotransmitters, so our serotonin, melatonin, dopamine. It's linked with kind of anti-inflammatory processes in the body. So it's really important to get it straight. And for methylation, we particularly need B9, B12, other nutrients such as magnesium, choline, potassium. And to go back to your question about testing, sometimes I would test methylation, someone's genetics, to see how well they're methylating with people when they come in.
So is that something so that you can do the vitamin testing via the GP, but methylation testing, can that be done with the GP?
No, that's a private genetic test. So it's quite easy. It's just a swab on the inside of the cheek and you send it off and you get the results. And your genes never change. So it's a way that we know where the weaknesses in the pathways might be and what nutrients and what foods and what lifestyle changes we can use just to support those weak spots, so to make sure that we're methylating well. But I think regardless of genes, B9 and B12 are necessary in good amounts for anyone anyway. So even if it's just the GP blood test, we can see if they're low, and that's an area that we'd focus on. With foods, genetically, not everyone can extract B9, which is also called folate, from foods. So a genetic test might tell us that you're not absorbing B9 from foods very well, in which case we might look at supplementation if the person wants that.
And if you're not, so let's take B9 as an example then. If you're not absorbing B9 from your food, I'm assuming just swallowing a supplement isn't going to solve the problem.
So depending on what the blood tests come back at, we'll have a look at the folate in the blood. If it's low, in that case, a supplement. And generally, I would use a liquid supplement or a powder because it's better absorbed, just to increase your levels of folate. So you've actually got something coming into this methylation cycle to start off with, because it uses folate as the fuel, really.
And so what are the different ways? Like, are they like oral things? Are there different ways to get those supplements into your body? Because I know that you can get B12 injections or like the sublingual, like, or can you, or is it just about more quantity and swallowing more of that?
Yeah, so you might need to, depending on the levels, maybe supplement, and I prefer the liquid supplements, but also food first. So making sure, so folate, for example, is in green leafy vegetables, in organ meats, particularly if somebody's eating those. But then we go a step further to look at digestion. So somebody also needs to have good digestive capabilities, as well as the genetic predisposition to be absorbing it from the foods. They also need to be digesting, breaking down those foods well to actually get the folate out of the foods in the first place.